And so I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. Hello, hello, hello. Welcome to today's episode of Keeping It 100. I am your host, Dr. Kristin Motley. So excited and thrilled to be here today. We have a really, really extra special show today. So let's go ahead and get right into it. My co-host, Dr. Georgie Mink, the street practitioner, he is MIA. I hope everything is okay at his job, but I am going to be joined by Dr. Tyan Thomas. So let me see if I can get her up in here. But I just want to kind of start off by saying, let me see, that just giving a quick update. So something big happened yesterday in terms of the COVID vaccines. The CDC has a new recommendation out. We still have about 1,300 people die from COVID each week in the U.S. That is a big deal. And as I've been telling you week after week, a lot of these deaths are from people who are older adults or people who have weak immune systems. And so the CDC met yesterday about providing a second booster to those populations. So we're talking about older adults, people who are 65 years and older, and people who have a weak immune system. It could be weak because they have certain diseases or because they're on certain medications. But those are the groups of people who this CDC is now recommending a new booster dose for. So here is the schedule. It's two different timelines for those groups. So if you are 65 and older, you should be getting a second booster 4 months after your last booster. And I'm talking about the Omicron booster. So that one was released in September. If it has been 4 months or more since you got that last booster back in September, you should, in you're 65 or older, you should be going to the pharmacy and getting a new booster. Hey, Dr. Thomas, thanks for joining. Hello. I appreciate you. I'm just kind of going over the new COVID update that came out from the CDC yesterday. If you have a compromised immune system, you should get the second booster, the Omicron booster, 2 months after your last dose. So again, that new booster came out in September. If it has been 2 months since you've gotten that last booster, the Omicron booster, it's now time for you. It's now highly recommended that you get a second booster at this time. And the reason is because your protection, if you are an older adult, if you have a weak immune system, your protection doesn't last as long as everyone else. They've been looking at the studies. This is not new information. Canada and the UK had already had these recommendations in place for their citizens. So we kind of knew that it may be coming. So it came yesterday. That's what the recommendation is. Dr. Thomas, have you heard about it or do you have any thoughts?
No, I haven't taken a look at it, but it makes sense. It's kind of how it is with flu vaccine and everything. And I think it's a good thing. It's simplified. It's not like all of these check boxes and don't know if you need it. So it's easy and people can decide if they want to get the next booster or not.
Yeah. So the choice is yours. Nobody's making you do anything, but we want to make sure that you stay informed. And if you have questions, you can always reach out to us and ask questions and just be patient with the process. Remember, this was a new disease. We didn't know what to do, how to prevent it. We didn't know, how to manage this. So this was new in the beginning and it's still new and we're still learning. So as we learn, we share new information. So you can't expect us to have all the answers ahead of time and know that, you know, you're only going to need 1 dose or you're only going to need 2 doses. Like, you can't predict that because the virus is ahead of us and it's going to stay ahead of us, and we're going to be responding to it, trying to predict it as much as we can, but it'll be changes coming down, and we just have to learn how to make good health decisions for ourselves. That's what this show is about, providing you with information so you have another source of information and you can learn how to make good health decisions for yourself.
Follow the data, right? Yep. Got to follow the data. So we have to make sure the studies are quality studies. Take time to, you know, get the rules for the study set up, get people enrolled, and then you have to give time to make sure, you know, that the vaccine is working. So I think we have to be okay with knowing that things could change, right? I'd rather do something differently because the data suggests it's better than to keep doing the same thing so we don't have to change, you know? So.
Exactly. And I appreciate that the things are changing, that they're looking at the data and that they're making recommendations based on the data. And it's comforting to see that other countries are doing it as well. So, you know, they're not making this stuff up. They're doing the best that they can to help us, to help save lives, to help to save on healthcare costs. So we just have to learn how to make good health decisions for yourself. That's pretty much it. The other thing I want to mention is that I know everyone has heard this by now, that Jamie Foxx is in the hospital. He's been in the hospital for almost a week. I've heard speculations of what it could be. I haven't seen anything confirmed, but our prayers and our thoughts are definitely with him. He is so talented. He can sing, he can act, comedian, classically trained musician. I mean, just Black excellence. And so we are praying for him, and we are thinking of him and his daughter and his family, and hope that he pulls through. I did read today that he is getting better, and so that was good to read.
Yeah,
Have you heard anything about it, Dr. Thomas?
I don't know what the condition is, but I heard the same thing. I hadn't heard that he was getting better, so you're giving me news as well. But I mean, I think it just really shows we just have to keep up with our health, right? Like, even if we are, you know, the riches of the rich, you know, poorest of the poor, like, our health, like, it's catch up to you, you know, if you're not keeping up with it. So, you know, I think it just shows the importance of making sure that we're maintaining our health the best we can. And I just, similar to what you said, you know, prayers that he has a speedy recovery, and, you know, whatever happened, he's in good hands at the hospital. I don't know what hospital it is, but I'm sure it's a good hospital. I think he was getting a procedure or something, was it? Or I don't remember what.
So I didn't even hear that much, but the way that his daughter wrote the post, like he had a medical complication or a health complication.
Yeah.
And so I immediately thought that he was already under the care of a provider and it was a complication that happened. But I know that he's in Atlanta and he was filming a new movie. So I don't know. But I do know this. We have to take care of ourselves, and we have to remember that the world will move on when we are gone. So we have to do what we need to do, because I was reading today, I know that him and Cameron Diaz are filming a movie together, and she's still taping because the world is going to go on. Like they can't, you know, they have a stand-in for him, which is appropriate, but there's money that is not being made when no one is working. Like, so you have to keep the crew working, so they're still moving along with his stand-in. And so it's important to realize that our lives have to matter to us more than to anyone else. So when you're not feeling good, use your vacation time, take off work. Don't say, oh, I gotta be there because they need me. No, they're gonna have a stand-in, show up, and get the job done. The job gonna get done whether you there or not. So like, we gotta change our mind, because we're these hard-working Americans, and we gotta be there. And don't nobody need you but you and your family.
That's a whole other conversation.
It is.
I don't want to go off topic, but yeah, Americans, we look at work differently. I heard somewhere where this author or this reporter is saying that Americans are replacing religion with work, right? So you go to work to build community, like people used to go to church to build community. And I was like, I said, that's a lot, because I don't go to work for that. But I can see what people who do are thinking, she's not a team player. Like, what's she doing here? So anyway, like, connecting it back to, you know, work and where we fit and how we view work, you know, we have to make sure we're doing it for what works for ourselves and our personal values, and not let other people's views on work like cloud our like pathway and where work fits in our bigger lives, you know. So that's a whole thing. We need to do a show on
A,
that too.
a
It's called
whole
workism. It's a whole. They say he said it's almost like a religion. Workism.
workism.
Yeah.
All right, I'm over here taking notes. We're gonna put that on the schedule for sure. Oh, oh my goodness. So those were the things I wanted to update everyone on. As you all know, it is Child Abuse Prevention Month, and we are providing parents with the tools they need to just take better care of their children, especially when it comes to health. So on today's show, we are going to be talking about like the history of vaccines. Have they made a difference? What was, what is the point of all this? COVID made a really big stir and caused a lot of confusion, division, fears, and frustration. It's just like really been a mess, especially with getting people the information that they need to make good health decisions. It's been challenging to do that because you got to get through the fear and you got to get through the trust and this number of barriers. It's a lot. So today I wanted to ask the vaccine expert that I know to come on and talk about, do vaccines matter? What is the point of all this? And so Dr. Onyi Ezeugo is on with us today. And so let me try to bring her in. And Dr. Thomas, I'm going to take you off because I'm probably going to mess something up. So let me take you off. Thanks for coming in. We appreciate you.
Thanks for having me. Thanks for the show. Talk to everybody soon.
See ya. So let me just introduce you. As I mentioned earlier, I wanted to have you on the show because, COVID just really, it's not something that we expected. We weren't prepared for. Obviously, we couldn't have been prepared for it, but I feel like it caused a lot of confusion and frustration and fears. And so I just kind of wanted to, just kind of go back to the beginning, especially when you're talking about vaccines. Like, what kind of impact have vaccines made? Have they ever mattered? Have they made a difference? And so when I thought about that topic, I said, I'm going to call my vaccine expert and let her tell us what the deal really is. And so Dr. Onyi Ezeugo is a senior health systems manager with Janssen. She recently transitioned to this role after serving as a medical science liaison for 2 years. As an MSL, she focused on vaccines and was responsible for establishing relationships within the clinical and academic communities to engage infectious diseases and vaccines, key opinion leaders, and population health decision makers. She earned her Doctor of Pharmacy degree from Temple University School of Pharmacy, and she is also a board certified ambulatory care pharmacist. So y'all know I only bring the best of the best on to teach us and to share information, and we certainly did that today. Before we get started, I do need to read this disclaimer. Here we go. The educational content of this Facebook and YouTube live chat is not intended to be taken as medical advice and should not replace the recommendations and advice of your doctor. Any questions specific to your health or treatment should be discussed with your healthcare provider. Any side effects experienced while taking a Janssen product should be reported to the Janssen Medical Information Center at 1-800-JANSSEN. That's 1-800-JANSSEN, JANSSEN. If you prefer, you may report side effects of prescription drugs to the U.S. Food and Drug Administration, which we know as the FDA, by visiting www.fda.gov/medwatch, www.fda.gov/medwatch, MEDWATCH, or calling 1-800-FDA-1088. Now that legal is happy, let's get this party started. Thanks again for coming on the show. And again, I just kind of want to, start at what impact have vaccines made over time, if any. So what has been that general impact over the years? Do they generally cause more harm or more good, or what can you share about the impact of vaccines?
Thanks so much, Kristin, for the introduction. It's a pleasure to be here, and I'm happy to be here. In regards to your question, vaccines in general represent one of the most effective disease prevention tools known to public health. Like every medication, potential side effects may occur. Vaccines can protect you and your child from many serious and potentially deadly infections. You can also protect people in the community by helping stop the spread of infections from going from one person to the other. When you think about vaccines and the way it works, it may also help reduce or potentially eradicate certain infectious diseases, for example, smallpox, if you have enough people that have been vaccinated. So it's important to note that vaccines in general undergo rigorous safety testing before they are being introduced to the market. So that way, even when they make it to the market, vaccines are continuously being monitored by the Federal Food Drug and FDA, Food Drug Administration, monitored for side effects after they are being introduced. Knowing that vaccines may cause side effects, depending on the individual, is important to know that that's being monitored. Overall, vaccines are only licensed if the benefits outweigh the risk for the vast majority of individuals that are going to be using the vaccine. So, for example, children and adults. So essentially, that's a brief overview. If you have any specific questions, just like Kristin mentioned, please feel free to reach out to your healthcare provider for further questions if you have about specific vaccines.
Okay, thanks. So in general, like you mentioned, they have to undergo rigorous clinical trial process. And then the FDA decides if they can be available for the general population to use. So then they have to be safe. You want and be able to pass FDA approval without FDA determine that there's more help that would happen from having the vaccines than hurting people, essentially. And so that's good to know. So it's good to know that that the process that have been used to get vaccines as long back as smallpox approved, that same process is still in place. And I'm sure it's even more rigorous now, especially with COVID. I'm sure there's more eyes on this than ever. And we actually did a show on vaccine safety a few months ago, and one of the MSLs from a different company had explained that it's more resources put into COVID vaccine monitoring than ever before. And so that's really reassuring as well. Now, I wanted to ask you, what vaccine in particular has been shown to have an impact in improving our lives? So like preventing death or the burden of diseases. Is there anyone like highlight star that you want to point out?
Yeah, thanks for that question. And one example that comes to mind, and the first one I want to share with you today, is smallpox vaccine. I mentioned that earlier. That vaccine has been able to essentially help eradicate smallpox all over the world. Smallpox, as a background, is caused by varroa virus. And people that present with smallpox generally present with distinctive progressive skin rash and fever. And it can be spread from one person to the other by direct face-to-face contact, via cough or sneezing. It can also be spread via scabs that present on people's skins, fluids, or contaminated materials when people come in contact with these sores on the bodies of other individuals. When you think about smallpox, overall, majority of the people that get smallpox will get better. However, about 3 out of 10 will with smallpox infection will die. And that was what happened many, many years ago. Many people that survived smallpox infection those that survived had permanent scars on their faces and even large areas of the body. Because so can you imagine, you get smallpox, you survive it, you have these permanent scars on your body. People had that. Some people were also left blind. As thankfully, with the help of vaccines, smallpox vaccines specifically, smallpox was eradicated due to successful vaccination. And no cases of naturally occurring smallpox has occurred since 1977. So look at that. Since 1977, the whole world has been smallpox free. In 1980, the World Health Organization acknowledged the eradication of smallpox. And this is the only infectious disease to date that has achieved this distinction. So this highlights a profound public health success and is due to the use of smallpox vaccine. Another example I want to share with you today is influenza or flu vaccine. Now in the US, we see this every year. This vaccine for flu has helped reduce death and illness. Flu, as you may already know, is very contagious. It's caused by influenza virus, and it infects individuals through the nose and infects the nose, the lung, and the throat. And people usually present with mild illnesses, so like a simple cough and cold symptoms, to severe sickness that can even lead to hospitalization or death. Every year in the US, many people get sick from the flu. Some individuals may die from it. Anyone can get the flu, even healthy individuals, right? No one is safe from flu. You can get it depending on, if you're exposed to someone or not. And some individuals are at most high risk of influenza, getting the flu vaccine. And these may cause serious complications relating to the flu. So some individuals that come to mind are individuals that are very young, so young kids, pregnant women, people that are 65 years of age and older, as well as people that have certain chronic medical conditions. So think about patients with asthma, diabetes, heart disease. Those individuals are at high risk of getting the influenza vaccine. So the goal here is that getting a flu vaccine every year, when the time it is to get the vaccine, is the best way and most important step to prevent flu. The vaccination can help reduce any flu infection. It can also help reduce visits to the doctor's office, or even preventing you from missing days at work or school, and also future complications due to influenza. So I'm going to leave you with that, but those are the two main examples that come to mind when you think about the impact of vaccine and how they have helped prevent or eradicate illness to date.
That's wonderful. And smallpox being eradicated so many years ago is incredible. It's a phenomenal feat of people taking the measures that they need to take to protect themselves. And it's crazy, so many years later, decades later, now we just, are so divisive that, we just pull in one direction or another. And it's not even just the divisiveness, it's just the trust and, the breakdown that has happened over the years. It's really unfortunate that so many people are still dying from a disease that has a vaccine. 1,300 people a week from a disease that has a vaccine. It's sad. It's really sad. But thank you for that information. Now, I wanted to talk about this a little bit because with COVID, a lot of people just assume, because they didn't know, that if you got vaccinated, it should prevent you from getting COVID. And that was never the message that came out. It was always the vaccines prevent you from having severe COVID that would have you go to the hospital, or that would, cause your life to end. So we were preventing hospitalizations and death. Those were the two things that we were expecting the vaccine to do. But a lot of people say, well, I'm not getting vaccinated because if I get vaccinated, I can still get COVID. So my question is, in terms of the history of vaccines, to what extent have they prevented people from getting the disease, or limiting the transmission? Has there ever been a vaccine that was able to do that?
Sure, that's a good question again, Kristin. An example I want to share with you all today is chickenpox. Now, chickenpox may not be very common to a lot of people in the U.S. at this, today, but several years ago, it was common. And even in some other countries, it is still rampant as we speak today.
Wow.
Chickenpox is very contagious, and it's caused by a virus called varicella zoster. People with chickenpox present with a blister-like rash on their body. It itches them so much. They are very tired, and they may also present with fever. As I said before, chickenpox was very predominant in the U.S. several years ago, and you can see that in some countries now. According to the U.S. CDC, 2 doses of the chickenpox vaccine are about 90% effective at preventing chickenpox. That's why to date, children that get vaccinated, people that keep up to date with their vaccination, they get this chickenpox vaccine, right? And by getting the vaccine, you're able to protect yourself, your family members, and other people in the community when you get vaccinated. Also, it's important to know that although you get vaccinated, if you get vaccinated, there is also a chance that you may get the infection after being vaccinated. It's not like, if you get the vaccine, you won't get it. You saw that with COVID and other types of illnesses. But it's important to know that if you do end up getting the infection after being vaccinated, it's generally mild. In the case of chickenpox, the person will end up having a mild infection with few blisters and slight or no fever at all. So that shows or highlights the benefits of getting vaccinated. Another example is measles. Measles is another contagious infectious disease, and it's caused by a virus as well. And when an infected person coughs or sneezes, the virus spreads through the air and it may infect others. Typically, the symptoms start with a cough, runny nose, red eyes, fever, then a rash, tiny red spots all over the person's body. It usually begins in the head and it spreads to the rest of the body. So several years ago, back in 2015, there was a morbidity and mortality weekly report, also known as the MMWR report. This report is published by the CDC, and it's used to inform the public about information on what's going on with public health in a timely manner. So back in February 2015, they published an MMWR report. And this was from a measles outbreak in California. So the California Department of Public Health was notified about a suspected case of measles. And this was from a patient that was hospitalized. This was an unvaccinated child, 11 years old, that presented with a rash at the hospital. And through the investigation, they realized that during the exposure period, the child had traveled to Disney, a place where kids go, everyone goes to have fun. The child went to Disney theme park in California and got that, with that measles. They didn't know they had measles. And through that, several other cases were reported from people that visited the same time, visited Disney World the same time the patient was there. By the end of that, about 125 cases were reported. And these were from majority of the individuals that presented with measles at that time were either unvaccinated or didn't know if they had the vaccine or not, or even undocumented vaccination status. So this outbreak illustrates the continued importance of ensuring, we are getting vaccinated, we're keeping up to date with our vaccination schedule, and through date, with the process, in being in place within the U.S. to prevent vaccination, it's been able to contain measles outbreak in the U.S. to date. So I'm going to leave you at that and see if you wanted to add anything else, Kristin.
Yeah, that's great. And I just want to say I had chickenpox and it was not fun. And it is incredible that these kids do not have chickenpox. And, you know, when I learned about chickenpox, when I was in pharmacy school, I asked myself, why didn't my mom get me vaccinated? Like what, was she an anti-vax or something? Why did I get chickenpox? When I looked it up, I realized that it wasn't approved until after I was born, like years after I was born. So there wasn't a vaccine. So mom, you off the hook for that one, because I was just trying to figure out why I got chickenpox. But it's great that kids do not, you know, you really don't hear about kids getting chickenpox. Because the vaccine has worked. Like vaccines work. They would not be available to us if they didn't. And I think that's a real important point to drive home, especially looking at the measles outbreak that you mentioned. The majority of the children who contracted measles, or the people that contracted measles, were not vaccinated, or they didn't have documentation that they had the measles vaccine. And so it shows that the people that were exposed that didn't get measles, that they were vaccinated, that they had that protection. So there are vaccines that work well enough to protect you from getting the disease altogether. But remember that no vaccine is 100%. If you do get vaccinated, the risk of you having a severe form of the disease is much less than if you were not vaccinated at all. So that was a really good point you made as well. I just wanted you to also share, I know you've been working in this field, in this industry for some time now, and I wanted you to talk about the vaccine development process, just to help patients and parents feel more comfortable, especially if they're behind on getting their kids vaccinated for any reason. I know that vaccination rates dropped off a lot through COVID, just because the doctor's offices, you know, changed their protocols, or people just didn't want to go out. You know, for me, I had a 2-year-old at the time, and I wasn't leaving. So he wasn't getting any vaccines because I wasn't taking him anywhere around anybody to get anything. So he was delayed. He's caught up now, but he was delayed. But a lot of people dropped off just the routine vaccines that people have been getting for years. And so I don't know if some of the COVID hesitation is like, I'm not getting the COVID vaccine for my child and I'm not getting anything else, or what has caused these drops to continue, you know, 2 or 3 years later. So can you talk a little bit about the development process, how vaccines are developed, just to help parents feel more comfortable with getting their children up to date on their routine vaccinations?
Yeah, thanks, Kristin. You bring up a really good point, and I know that this is something in a lot of people's minds. If I go through the process of, you know, development, we could stay here the whole day.
Yeah, you're right. I'm sorry.
I know that's a tough one. But I could, you know, summarize this so that everyone feels comfortable as they leave this discussion. Just know that there are decades, literally decades of scientific research and rigor that has led to development of vaccines, and is still ongoing now. Even when a vaccine is approved and is on the market, they are still looking it up. They're still monitoring these vaccines while they're on the market. All vaccines in the US undergo rigorous testing and follow a scientific and regulatory process with the FDA. And the FDA has this oversight to confirm that every vaccine that is approved is safe and effective. There's also a committee called ACIP, which is Advisory Committee on Immunization Practices. This is a committee of medical and public health experts within CDC, which is the Center of Diseases and Disease Control and Prevention. This committee carefully reviews every data about every vaccine, from clinical trials to other studies that they have when the vaccine is approved, to develop recommendations for vaccine use. So they do this after the vaccine is approved, to make sure that, you know, they make the recommendation that the vaccine can be used in the population, depending on the age and whatnot, right? So it's important that people know that this is being reviewed. FDA is reviewing it, CDC is reviewing it. And if anyone has any doubts or any concerns or any questions, it's important that people feel free to consult with their healthcare provider because they are equipped to provide you with the information you need to make you feel comfortable about vaccines. There's also government vaccination guidelines available in the public domain. If you go to the CDC website, all that information is open. So feel free to go there as well to read it up on your own or consult with your healthcare professional for further details. So I'm going to leave it as there and see if you have any other comments.
That was great. I know that could have took about 10 years to answer that question, explaining start to finish. But yes, there's a lot of people on it. And if there are any warning signs that anything is wrong, they are going to do a deep dive. And as soon as something comes up that says that this particular vaccine is causing a problem or a drug even, it is going to be investigated, and if it is deemed necessary, it will be pulled and everybody will know. So it's really good to know that the systems in the US are working, and that's, it's been comforting. It really has been, because I didn't want to get the COVID vaccine initially until, it took me a while to get vaccinated. And so it's not an easy decision. I completely understand that. But it was reassuring to realize that so many eyes were looking at it, and I was like, okay, I can make a decision now. So I know we talked about a lot today. So I wanted to ask if you wanted to just give the viewers 3 things to remember, just 3 things. What would those 3 things be before we close out today?
Thank you, Kristin. It's been a joy, sharing this information with everyone in the community. And as you leave this discussion, 3 main takeaways for you to leave with. Just remember, vaccines are one of the most effective ways to prevent infectious diseases. As you think about preventing infectious diseases, you are protecting yourself, you're protecting your family, you're protecting your community at large. Every medication may have a side effect, and that also is the case with vaccines. Secondly, vaccines may help reduce the spread of infections and complications from the disease. We previously talked about the flu vaccine as an example. And through my discussion earlier, I shared with you that flu vaccine may help reduce sicknesses and complications from flu, especially individuals that are at most risk. Think about the children, think about pregnant women, think about people with chronic medical conditions such as asthma, diabetes, or heart disease. You taking a flu vaccine, for example, in those individuals would help them prevent further complications and also prevent them from going to the hospital. Finally, keep in mind that infectious diseases are very contagious. Kristin talked about mentioned earlier that she had chickenpox. I also had chickenpox several years ago when I was a whole lot younger than when there was no vaccine available. And I remember how I had those blisters on my body and I was itching. Thankfully, everything resolved, right? So remember that had we had a vaccine back then, I'm sure I would have received the vaccine for chickenpox and I would not have had the disease. Or if I had that infection, it would have been mild and not as serious. So overall, vaccines may limit the transmission of the disease to others in the community and to your family, and ultimately prevent outbreaks like we saw with measles back in 2015. That outbreak occurred in California at Disney theme park. Think about a place where people went to have fun. People ended up getting the measles vaccine. So having a vaccine will help prevent outbreaks and help contain the spread of the infection. So getting vaccinated is very helpful for you to protect also those that cannot get vaccinated. There are some situations, some pregnant women or people with weakened immune systems may not be able to get a vaccine, for example, chickenpox, because the chickenpox vaccine is a live vaccine, and certain individuals like pregnant women or people with weakened immune system may not get it. So if you are relatively healthy and you get the vaccine, you're helping protect those individuals in certain instances that cannot get the vaccine. Ultimately, all vaccines in the US undergo rigorous testing and follow a scientific and regulatory process within the FDA to confirm that they are safe and effective. So with that, I want to say thank you so much, Kristin, for your time today. Remember that your healthcare provider is available to answer any questions you may have regarding vaccines and what is best for you. So feel free to reach out to them. And I want to say thank you. And it's a pleasure being here today.
Thank you so much, Dr. Ezeugo. We really, really, really appreciate you being here today and for taking time to share that information. Two things you mentioned. You mentioned something about pregnant women being high risk for certain diseases sometimes, infectious diseases. And I wanted to remind pregnant women that you are encouraged to get the COVID vaccine to protect you and to protect your baby. So that is a recommendation that's been in place for a long time. That the rates of pregnant women who are vaccinated against COVID had been low. I haven't looked at the data recently, but just wanted to encourage anyone that's watching or knows someone pregnant, make sure they get vaccinated for sure. And also, you said something else that made me think about something. I can't remember, but everything you said made a lot of sense. It was on point. So thank you again for being here. Just want to remind everyone, if you have Medicaid, renewals have started. Now they've been off, for a couple of years because of COVID, but they're back. So they may be slow getting to you, but you do not want to miss any notifications when they're trying to send you something in the mail or call you. So make sure that your state Medicaid office has your latest information on file. You can find their information online, and I'll make sure to put it in the description too. So make sure they have your current address and phone numbers if you have Medicaid, so you can get your renewal done. Also, our next outreach event is this Saturday. We'll be participating in the Environmental Justice Day Walk in Chester. It starts at City Hall. We're meeting up at 12:30. So come out to learn. If you heard anything about what Jeff Brown said in terms of us, of Chester being Chester and the trash needs to go somewhere and we have this incinerator that's polluting our city. If you follow that at all and you don't know anything about how air pollution in Chester is impacting your health, your children's health in terms of cancers and heart disease and asthma, you need to come to this walk and just find out. If you don't want to walk, you don't have to walk, but come and learn about the impact of air pollution in Chester, because it is real and the diseases are coming up in the numbers. They are coming up in the data. So please become informed. Again, we're going to be meeting at City Hall in Chester at 12:30 for the Environmental Justice Day Walk. And that is being put on by Chester residents concerned for quality living. Shout out to Queen Lean, Miss Zuline Mayfield, who is leading all of those efforts. Remember, y'all, COVID is not going anywhere. Make sure you stay up to date on your vaccines. Oh, this is what I wanted to say. If you don't have a healthcare provider, you can go to a pharmacy. So if you don't have a doctor, if you don't have a PCP that you see regularly because you don't have insurance or for whatever reason, you can go to a pharmacy and talk to the pharmacist and get your questions answered there. You can also go to a federally qualified health center, FQHC, put that in online, put in your zip code, and you can find a local community health clinic that can offer services free of charge or at a reduced rate based on your income. So healthcare providers are out there. Hopefully you can find one close to you and get your questions answered, and y'all can always contact me and I will do my best to answer your questions. So everybody, thanks for tuning in. Have a good day and check us out right here next week at 12:15. See ya.
Thank you.
Thanks again. I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do.